Good morning, everyone. Hope everyone's having a great week so far. As always, I'm your host, Dr. Steven Zom, here for another episode of our Oral Pathology Corner on Tooth Teacher Tuesday. Today, discussing, I would say, probably an oral pathology that pretty much all of us are familiar with, but maybe don't understand some of the implications of it. And that topic is cleft lip and cleft palate. And so most of us are familiar with what it looks like. It's going to look something like this. And, I think most of us, when we think cleft lip, cleft palate, we're just thinking it's more of a cosmetic thing, And a lot of us have probably seen before and after pictures of these children that are born with these clefts and, how they look after things are repaired. But it's more than just a cosmetic concern. The big thing with cleft lip and cleft palate is because the mouth has not formed completely and there is this cleft, this gap. Especially in newborns, it's going to make it very hard for them to nurse, which means that babies with cleft lip and cleft palate are going to basically be predisposed to being malnourished because they're not able to properly, consume the nutrients they need to grow and be healthy. And, obviously surgery is not always I shouldn't say ideal. Surgery isn't always the most convenient thing to do. And so correction of cleft lip and cleft palate as soon as possible is very important to ensure that children are able to properly nurse and then eventually able to eat everything else like normal. But in the event that it's not possible to correct those right away, there are alternatives. The biggest thing I can think of with cleft palate is sometimes a device, an appliance can be made that, for lack of a better word, kind of plugs the cleft in the palate to allow that child to nurse without, milk going up through their mouth and into their nose, where it's, just going to come back out their nose rather than getting into their system where it's going to be nutritious. So again, a condition that all of us are very familiar with, I'm sure, but one aspect of it that maybe many of us don't realize is the impact it can have on proper nutrition and feeding. So that's all I've got for today. Pretty simple. So hope everyone is having a great week, and thank you as always for the pleasure of your time. And I hope you will tune in next week to another episode of Tooth Teacher Tuesday.